So, hi, my name is Angela Lundy. I am an associate here at the Mayo Clinic in the Department of Neurology, and I have the great pleasure of sitting here today with Lisa Gruner from the Alzheimer's Association. And we want to have a conversation mostly to tell you about an opportunity coming up on November 4th, the Mayo Clinic Conference on Brain Health and Dementia. So Lisa, want to just say a couple words and introduce yourself?
Sure. Lisa Gruner. I'm a health systems director at the Alzheimer's Association, and that means that I'm supporting health systems and clinicians with improving care for people experiencing Alzheimer's, including caregivers.
And Lisa, I'm really excited that this conference is actually going to take place. It's been in the works for a long time. We know now that we're actually able to gather people together to have this event here in Rochester, Minnesota, in person. But if you can't come in person, we're also going to be offering it as a live streaming opportunity. But I think what this really does is it's a conference that's really intended for those who are living with dementia, for the millions who are supporting somebody in their home or a relative living with dementia. But also the conference brings AARP is joining us as well. So we know that there are a lot of people out there who are just maybe concerned about memory or really wondering what they can do to just improve the overall health of their brain. So I think the conference will really provide an opportunity for all of these topics to bring together all of these individuals.
Would you say that it's unique in that it brings together the research about Alzheimer's disease as well as supporting caregivers in their daily journey with Alzheimer's?
Yeah, it really is. It's a perfect blend of both. We know people are interested in their research, and actually this is a really important time to come and hear about really where we're at in research and where we are really at with some disease-altering therapies, which we can talk a little bit more.
It's a really exciting time.
Yeah.
Yes.
Maybe you'll just say a little bit more about that.
Right. So we know that there are a lot of opportunities coming up where people will have more options for what kinds of treatments might be available to them related to Alzheimer's disease. And so in addition to all of the therapeutics that we know currently exist for supporting someone with the symptoms of Alzheimer's disease, now we're really looking at treatments that can support or change the biology of the disease. And that's a real big game changer for people's experience with Alzheimer's disease. We also know that there's a lot of important research related to how can we support caregivers in a more meaningful way. And so I think this conference will be a really nice way to bring that information together in one place and really get everyone the knowledge that they need on the topic.
And I'm so glad you brought up caregiver research as well, because that's near and dear to my heart. It's a real area of interest that I have. And one of the things that we'll be showcasing at the conference is some of the caregiver research that we're doing here at Mayo Clinic, as well as some things that I think are being done around communities across the country. But you mentioned that it really is a blend of bringing together the research. But the other thing I really want people to know about this conference is it's also about the day-to-day practical things we can all do together that are really focused on improving overall well-being. The theme of our conference is Path to Emotional Well-Being.
And Angela, you've been working with caregivers and people experiencing Alzheimer's for decades now. I wonder if you can talk a bit about how does that look in your daily work? What have you seen in terms of changes over the years, and what are you excited about?
Yeah, well, I think one of the things, just to get real, that caregiving is difficult. And if you go to the facts and figures report that just came out from the Alzheimer's Association, it gives a lot of information about really just how difficult caregiving can be, dementia caregiving in particular, on one's physical and emotional well-being. So we don't want to sugarcoat this, but at the same time, I think one of the things that I've really come to appreciate and realize is that there are paths to living alongside these diseases, whether you're the person with the disease or whether you're a care partner, that really do lead to improved overall health and well-being. So I think the conference, in fact, I know the conference is going to start to showcase those and to really give individuals that practical way of understanding how they can live with these conditions and how they can care for somebody who does.
Right. I understand that well. Our family experienced Alzheimer's and was supported by clinicians at Mayo and participated in the Mayo study on aging. And we remember that process of doing all the care coordination, making all the appointments, trying to figure out how we can make those meaningful experiences with travel and all of the things that come with that. And so it's exciting to hear that this is a place where people can come and learn about ways that they can experience the new research and new caregiving ideas, and I think this conference will be a really important way for people to do that.
And so, Lisa, you said that this was personal to you, and that you came to Mayo and that you were able really to understand how to navigate this. But that's not the case for a lot of people, right? I think getting to the doctor's office, having a conversation, getting a diagnosis, the facts and figures report is telling us that that's not happening.
Right.
Say more about that.
Sure. So each year, the Alzheimer's Association publishes a document that combines all of the information that we know currently about Alzheimer's disease and related dementia. In that, we know that it talks about caregivers, it talks about clinical advancements, talking about implementation science of the research that we know about. One of the things that we know from this is that 6.7 million Americans are experiencing Alzheimer's disease. What we know is that over 53% of caregivers in Minnesota are experiencing other chronic diseases that aren't being managed successfully as a result of being a care partner. And so how can we be more thoughtful about the ways that we support those care partners and make sure that they have access to community resources and all of the knowledge about the care so that they can be the leaders in their care, and really not just be the recipients.
So getting a diagnosis is really just the first hurdle.
Right.
But once you get that diagnosis, which I think can be extraordinarily difficult to hear, but extraordinarily empowering, because it puts people now on a path, and they're just not wondering what this demon is that seems to have impacted their life. But then once they have that diagnosis, it's really making sure that they're connected to the kinds of things that are really going to make living alongside these diseases much more manageable. You know, you've mentioned now that this conference really, I think, will have some great opportunities, especially for those caregivers, those care partners. And I think in the facts and figures report, it said that, you know, that number is probably like 11 million families who are out there doing a lot of the support for these individuals who have dementia.
Right.
So at the conference, so much of our focus will be on really supporting these care partners, empowering them with knowledge. There's some great sessions that you'll hear. One is from a Lewy body dementia caregiver by the name of Helen Metzger, and she talks about the gifts of caregiving. She doesn't dismiss the fact that caregiving is hard,
Right.
but alongside it can be these gifts. They're not mutually exclusive. We have a couple of individuals coming from a wonderful nonprofit called Lorenzo's House that focuses on young onset. Really realizing that not everybody who cares for somebody with Alzheimer's disease or a related dementia is an older adult, that sometimes the care partnering falls to younger children or young adults. There's some sessions about caregiving specific to African American communities, and a program that a woman named Robin Frazier from the University of Minnesota is going to highlight about what African American communities are doing. And just talking about communities in general, there's a lot of action going on in small communities around Minnesota and our surrounding states. We want to make sure that people coming to the conference get to understand what might be happening in their own communities.
And it's my understanding there's also going to be a connection with art and caregiving. Can you talk a bit about that?
Yeah, well, right here behind me is the Rochester Art Center, and this is the conference space, a beautiful space where the conference is going to take place. And Ann Leibovitz is an international artist, and she spoke at Mayo, and she's been involved in really helping people understand the intersection between art and well-being, and the intersection between art and dementia. So the conference will not only provide an opportunity for people to meet her, to see her art, but there's going to be a lot of opportunity for engaging and participating in art, all in an effort, I think, to give people a day of feeling a sense of connection, belonging, and greater well-being.
What a beautiful opportunity. One of the phrases that I like most when we talk about care partners is the idea of providing dignity and ease. And I think what you're describing with this conference is a fantastic opportunity for people to not only get the knowledge that they need, but also a sense of dignity and ease in their caregiving.
Absolutely, well said, well said. So once again, the conference, November 4th, here in Rochester, Minnesota. You can go to our website, which you'll see at the bottom of the screen, to register and to get more information.